Some of the things I love in life are peanut butter cups, bad 80s rock ballads, and functional slash occupation based activity ideas. Can you guess which one we're going to talk about today?
Welcome to the Seniors Flourish podcast, where it's all about helping occupational therapy practitioners disrupt the norm by throwing away the rainbow art and being the best you can be when working with older adults.
Welcome, everyone, to the Seniors Flourish podcast. My name is Mandy Chamberlain. I'm an occupational therapist, and on the show, we like to talk about everything about occupational therapy and working with the older adult. And today, we have a topic which is near and dear to my heart. We're going to be talking about creative and functional approaches to working in a skilled nursing facility. So, if you are not in the U.S., I try not to use mnemonics, but it's so hard. But we call it a SNF, SNF, for skilled nursing facility. We end up throwing it around, but I'm going to try really hard not to. But like I said, one of the reasons why this is so near and dear to my heart is because I've worked in skilled nursing facilities, PRN, since not the very beginning of my career, but a large majority of my career. And it's one of my goals for the Learning Lab. So if you're always looking for more ideas and tips, be sure to join us in the membership and check it out. And I'll put that in the show notes as well. But today, Timisha Tross, she's an occupational therapy assistant. She is joining me to tackle this topic. So welcome, Timisha.
Thank you so much, Mandy. Thank you. So happy to be on.
Yay!
Yay!
Is this going to be fun? I'm really excited.
Yeah.
So let's just talk a little bit about your background and your OT journey and how you got to what the heck you're doing today.
Sure. So pretty much it started off, actually, my plan wasn't even to become an occupational therapist. After high school, I told myself, okay, I got to do something with my life now.
Well,
So, me and my dad was visiting colleges, and we decided to go to one college in Massachusetts, which is where I'm originally from. And we decided to go into like an open house and just kind of sit in and listen to the medical professional programs, because I know I wanted to work with people and I wanted to, be in some kind of medical field. So when we went, my dad was like, all right, well, let's go sitting and listen to the nursing program. So I wasn't really gung-ho about it, but I'm like, all right, let me go listen to it. So we're sitting there and, they have different sections in the auditorium where we were at, and they were kind of like sectioning people off. And there was like, everybody that's here for, nursing, move to the left, and everybody here that's for occupational therapy, move to the right. And, they were calling out different things. And I was like, occupational therapy? I'm like, what the heck is that? Never heard of that before.
Yeah. So
I said to my dad, I'm like, Dad, let's sit in for this one. And he's like, no, we're here for nursing. You're going to be a nurse.
Thanks, Dad.
And I'm like, I already know what nursing is all about. I never heard about this. Come on, let's just sit in.
Yeah.
So reluctantly, he was like, all right, fine. So we decided to sit in and listen about the profession. And it was just like as corny as this may sound, it was just like a light bulb that went off. And I'm like, that is it. I'm like, this is what I want to do.
Yeah.
Right. So, when you first find out about something, you're like excited and you're like, you want to run home and like jump online and like YouTube everything.
Yeah.
So, I went home and I started researching, and I'm like, oh, this seems really neat. And I told myself, all right, before I really jump heads in, let me go and try to see if I could do a shadow someplace. So I ended up getting into a rehabilitation hospital for about 2 days. And I was able to shadow OT and kind of just, see how she worked with the patient. And I just thought it was so cool. She actually was certified in driving evaluation. So I got to see that as well. And, the hospital that I went to, I mean, it was really decked out. I mean, they had a movie theater, like a mock movie theater. They had a car.
My God.
They had a whole apartment. Like, it was a grocery store. It was the real deal.
That is like an OT dream.
It was absolutely an OT dream. And I'm like, this is what it looks like. This is amazing.
Yeah.
But, as I applied for school, when I saw initially I was going to apply for the OTR program, the OT program, and
Mhm.
because of financial reasons, I decided, you know what, let me go for the COTA,
Mhm.
for the OTA program. And long story short, went in for the program, failed the test. We actually
Oh,
had to take a
no.
test to get into it.
Mhm.
And I failed twice on the same subject with the same score. And
No.
I thought I was gonna have a heart attack. I was like,
Yeah.
"What?" Because you're excited and you're like, "I could do this," and then you go in, and then you hit a little stumbling block.
Mhm.
So I was like, "Oh my gosh, is this it? Am I not going to be able to be a OT?" And
Mhm.
I went to to one of the advisor, and they was like, "Well, do you have a plan B?" And I'm like, "No, I don't have plan B. This is plan A."
This is it.
And I'm like, "This is it." And I'm like, "I'm not leaving your office until you give me like direction."
Uh-huh.
So she was like, "Well, you could go talk to the chair, the board, and whatnot." So I said, "Okay, that's what I'm gonna do." So, I went same day. I went, sat down with somebody. Well, I should say, sat down with the chair of the program, the department head, and kind of pleaded my case and was like, "Listen, I might not be the best test taker, but I know this is for me."
Mm,
And I was
mhm.
like, "Tell me what I have to do." And she was like, "Well," she was reluctant. And she was like, "Well, if you take tutoring for this," and it was actually English is what I didn't pass on. And I passed the math, passed the science, and the English. And I've always had a struggle with English being born from another country.
Mhm.
So I said, "Okay, fine, let's do it." And, before I left her office, she was like, "You're a rare case." And I said, "That's fine." Yeah. So I, finished my tutoring, you know, um, passed all of that, got into the program, and I end up getting into the program and end up being first in the class in the program.
Oh, that's tenacity, girl.
Right, right. To the point where they gave me a Rose Caporoli award
Oh, wow.
for excellence in the program as well as clinical. So with that, I was off and rolling, and my professor told me, "You know what, Tamisha, I don't know if you should do travel therapy," because I was like, "I'm gonna jump into the world and I'm gonna do travel therapy
Yeah,
right
yeah,
out of school." And she was like, "Well, I know who you are. I think you could handle it, but I don't advise you to do it."
yeah.
But I said, "I think I'll be all right." And I have to say it was probably one of the best decisions I made because it really taught me how to adapt to every single environment I was put into.
Mhm.
So I initially started off as a travel therapist, and then I did some per diem work, primarily in skilled nursing facilities. I was in a sensory integration clinic for pediatrics, but my niche is really seniors, elderly, older adults.
Yeah.
So that's my story, and I'm sticking to it.
That's a good one. Well, and it is inspiring, especially when, you talk about, like, failing and then,
Mhm.
succeeding, and I feel like I love when those stories are shared just because I feel like everybody feels like everyone passes everything at all the time, and that
Right,
it is a block. Well, it is a block.
right,
I'm not saying it's not a challenge, but
right.
gosh, it's
It was
so
it was
nice to
definitely a
hear.
journey. It was definitely a
Yes, that's
journey,
a good way to put it. Good way to
and
put it.
I did go back for my bachelor's degree. Again, was gonna say, you know what, I might as well go and get the master's.
Mhm.
Went, got my bachelor's degree, but then life kicked in again, and
Yeah.
financially, I was like, I may not be able to finish this.
Yeah.
So I
Yeah.
actually was satisfied with just continuing as a coda. I actually really
Yeah.
liked that. Um,
Mhm.
Especially in my setting, just watching some of the OTs with the amount of paperwork they had, and it would look getting a little stressed. I said, you know what, being a coder is not such a bad thing.
I can agree, especially it depends on the setting, of course.
Right.
But let's talk a little bit about, like, why do we were the subject we're trying to tackle is about, like, fun, functional, getting creative, and why do you think that that is such an important aspect in working in, like, a skilled nursing facility?
Well, we are functional beings. Now,
Ah, I know.
despite
Yeah.
our age,
Mhm.
that's how we really have to view it. because in our daily lives, we don't do activities the same thing repeatedly over and over and over again. There's changes. Sometimes we have to adapt in our daily lives. So the same approach should be applied to when you're working with your patient within these facilities.
Mhm.
You know, um, it's important to remember that they're there to regain function, not only there to just walk or exercise. You know what I mean? And by
Mhm.
doing things that they have interest in, it provides that fun. And when you're doing something fun, you don't think about time.
Isn't that true?
You know what I mean?
Yeah.
And when you're doing something that is functional and it creates that fun tenacity, you also end up with a motivated patient.
Mhm. I agree. It's one of those things, like, I think sometimes it's hard. Sometimes I do feel like some people have a harder time than others of tapping into, like, what is meaningful and fun to, clients,
Yeah.
especially, in skilled nursing. But I mean, I completely agree. It's just like, oh,
And it comes back to that client centered approach as well.
mhm.
You know what I mean? And I mean with the hustle and bustle of a day to day schedule, sometimes that gets lost.
Mm,
But
mhm.
for me personally, if I can continue to do things that's functional and fun, it makes it easier for me as well.
I know.
Because
Yeah, yeah.
it does because the session just flows nicely, and the
Mhm.
person's more engaged.
Right.
So
Yeah, I mean, I think occupational therapy is a fun profession. Like, it's fun. Like, you do things that are meaningful, you do things that are the occupations that the person needs to be, participating in. And there is a level of, like, I don't know, you're connecting with the client, and it's fun. In general, I'd say, it should be like, oh, we're laughing, we're having a good time, we're connecting, we're achieving, working towards our goals. You know what I mean? Like,
mhm,
it's a fun profession, and I think sometimes, like, working in maybe a skilled nursing facility can kinda get, I don't know, like, maybe, like, more of a bad rap for lots of things. But I'm talking, if you talk purely about the clients, they have so many fun stories to tell,
right,
and, I mean, they're people, right? And so it's just, like, finding that connection with them is fun in itself.
yeah, and
Yeah.
you gotta, and it's also a personality game too. If you look at
Yeah.
it,
Yeah.
you really have to know how to speak to um, people of different cultures and
Mhm.
different background. You know what I mean? Mr. Joe might be have more of an aggressive personality, and you can't really take it personal. You kind of have to know how to ease in there versus, you know, Miss Mary that is a little bit more quieter and more reserved.
Mhm.
So it all comes down to your approach as well when you're trying to engage with them and create an activity that is purposeful and meaning for them.
Mhm. Yeah.
Yeah.
So why do you think so many, OT practitioners, we don't all do it, but, I mean, and a lot of people end up kind of falling back to those rote or those non-meaningful exercise or activities. Why do you think we do that?
Well, honestly, to be honest with you, I think for some OT practitioners, it's easier.
Yeah.
It's probably easier because they get into a routine as well. Um, and I also believe that, well, I wouldn't say all, but I feel like a good amount of therapists also gets burnt out, especially with a heavy caseload.
Yeah. Yeah.
Um, so it really comes down to planning and organizing your day and planning and organizing with the patient. I mean, not to say that you're going to have the same patient every single session, but
Right.
you try your best to plan ahead.
Mm.
It's the best thing I can say, and that can also facilitate when you have those crazy, crazy schedules that you walk into in the morning. Um,
Yeah, you have this plan in your head how it's kinda gonna go, and then it just, like, goes out the window.
Right, right. Because it's happened to me a couple of times where I'm like, all right, Mrs. So and so, I'm gonna see you tomorrow and we're gonna continue with this and we're gonna do that. And then I walk in and then it's like, oh, I don't have you today.
Never mind.
You know what I mean? But
Yeah.
and sometimes when that happens, I would most likely relay the information to a coworker that does have that patient for the day.
Mhm.
Just to kind of keep that consistency and that carryover. Um,
Yeah.
but
Well, and
that's usually
I'm
what I would do in that situation because it is easy to kind of get stuck in a rut. Um,
oh, definitely. Well, and, like, I also do think that there is a level of, like, culture in certain in facility. Every facility has their kind of, like, culture of their team and how their, um director of rehab,
oh yeah,
manages
absolutely.
that team.
Oh
And
yeah,
I do think it's really challenging if you go in, you want to be really like occupation based, or you kind of get creative, or you're kind of doing your thing. I always say, as a OT practitioners, need to you do you. Like, don't try not to get sucked into what everyone else is doing,
right,
because
right,
you may have those people that are they're burnt out, or that's just the way everyone's done it for so long, right? Everybody's
right.
just and, you come in there and you're trying to get creative, and you may feel that pressure, like,
Hmm.
even if it's
Hmm.
not, like, said out loud, that pressure of everyone, no one else does this, or like, oh, like, overachiever or
Oh my
whatever.
goodness, I've gotten that so
Yeah?
many times.
Yeah, yeah, and there's a, like, a
Hmm.
maybe sometimes an unsaid level of, I don't even know what the right word is, but, like, especially, I think, as a new grad, that's a really challenging thing to kind of just get around, because you
Yeah,
do have to just kind of do you and,
yeah,
like, do what you think is best for your clients. But sometimes it's just I think it is hard when, especially in those settings where it's not the norm, when it
yeah.
should be the norm. Do you
Well,
know?
well, I actually agree with you because I've actually worked in over 15 buildings.
Uh-huh.
And I can tell you, funny story. When I actually first started out, when I was a new grad and I first started out my first year, I had an activity with a patient where I actually had the patient, make herself a sandwich.
Yeah.
And when I documented it, I documented very specifically, like how she opened up the package, how she
Mhm.
spread, how she it
Yeah,
was
you did the whole
very
thing. Good activity analysis skills.
right, right. And it was just funny because some of the therapists had read my note and they were just laughing about it, like, oh my goodness, look at how detailed you are about a sandwich. You know what I mean? But
Yeah.
that's what I learned. That's what I know.
Yeah.
And it carried with me throughout my whole profession, even when it comes to coming up with activities to do using certain tools and items that people wouldn't think about using.
Mhm.
I even had one instance when I went to a building and she was like, I was doing a kitchen activity and she was like, oh my gosh, it's so good to see a real OT in the house, and it just
Yeah.
and it just tells you like, wow, it's surprising, but it happens. And really the
Mhm.
dynamic of the facility really truly makes a difference,
Mhm.
you know?
Yeah, definitely. And I think some of the other challenges are, like, let's say, as a traveler, you're just popping in, right? Like, and as an OT assistant, you're not doing the evaluation,
Right,
right?
right.
So you're kind of popping in, you're going to see maybe a patient or a client that you haven't seen before. Like, how do you create things that are meaningful to the client, if, like, let's say you haven't done the evaluation, or
Mhm.
how do you get creative, how do you dig into that when you're just stepping in, or you
Sure,
know
sure,
that, along those lines.
sure. So what I usually do is, when I'm going to a new site that I've never been before, of course, I have to read the evaluation.
Right.
I gotta read the backstory to really get an
Mhm.
understanding, and I also read the last couple of notes, treatment notes,
Mhm.
just to kind of get an idea of the person's current level and what they've been doing. And when I do meet the person, I introduce myself and I pretty much just have a small little talk with them, ask them
Mhm.
how they're doing, what's your typical day look like, what's your ultimate goals, what's your plan, find out what they're struggling with, what their deficit is, and I
Mhm.
just take it from there. So it's just
Yeah.
it's just really having that short little conversation with someone, and surprisingly, a lot of them would actually look forward to that, because some therapists would just say, "Hey, how you doing? This is what we're going to do today," versus saying, "Hey, how are you feeling? This is my idea for a session today. How do you feel about that? Can we give this a try?"
Mm.
Because it kind of pulls them into the therapy, into the care, and also make them feel like they also have some level of control versus being told what to do.
Yeah. Well, especially in a skilled nursing facility, I feel like that is a huge factor, and you nailed it on the head, right? Like, it's like
Mhm.
they get a lot of that control essentially taken away.
Mhm.
And
Yeah.
and our treatments are supposed to be, this is a team. This is a team approach. It's not like this, dictatorship saying like we're going to do this, but like they have their goals and it's like figuring out.
Yeah.
So
A-
it's
And
so good to
and
use that.
the little things matter too. The little things matter. Something simple as just getting a person another pair of socks. Like, let's say they've been in socks for like 2 or 3 days, and they're like, "Man, it would be nice just to have another pair of socks." And bringing them those socks can actually create a nice dynamic and allow you to really break through with that patient to get them to do certain activities that they may either refuse to do or not typically do. And that also opens up a good discussion for their background as well.
Mhm. Yeah, no, that's exactly right. It's funny how like it seems like those are the things that sometimes seem so obvious,
Hmm.
but I think when you kind of get in your you get in your rut, right? Like you
Right,
sometimes have to make that extra effort,
right,
but it makes such a big difference.
right, right.
Yeah.
It does.
Well, and some of the other challenges I think are that some people say like we don't have any resources. Okay, so if you're in a facility that doesn't have like an apartment, a movie theater, a
Right.
grocery store,
That checks
like so like yeah, like that is like yeah, the OT dream. But
right.
how do you keep it fun? How do you keep it occupation based when you have those limited resources in your facility?
Okay, sure. So, well, I can. First thing I'll mention is actually just your basic, let's say your basic ADL suite, which we typically know you have, you know, like kitchen, tub, bathroom, bed,
Mhm.
those kind of things. So a little trick that I normally do is usually you'll have your basics. You'll probably have like maybe a tub bench, but no tub.
Right,
These
exactly.
kind of in these kind of facilities, you'll probably have like a tub transfer bench. You don't have a tub. Um, you'll probably most likely have like a high-low table, but no big table that goes up and down.
Yeah.
Okay. So what I would do to create, let's say I want to work on tub transfer training, focusing on just the basic ADLs, let's say a tub transfer training. What I've done in the past is I would actually elevate the high-low table to its highest point, and I would put that down on the floor, and I would actually put the tub transfer bench inside of it.
Mm,
So it kind of creates a simulated tub for you, because you have to be able to step into it.
mhm.
Okay, so that's kind of like one of the things I've done in the past where, the high-low table is completely extended. You have the top part, you have the bottom part, which kind of gives the normal width of the tub. And then placing the tub bench inside and outside also gives that feel as if you're having to sit down and bring those legs over the height
Mm,
of the
mhm.
tub.
Right.
So that's a little tip there that I would do for, let's say, if I need to work on tub shower kind of situation. Um, Now, if I want to get a little bit more complex, and let's say someone is really into golf, and of
Yeah.
course you don't have like a nice little golf putting area in their skilled nursing
Right.
place. So what I've done in the past is usually every facility will have tennis balls for their walkers, right? And every
Mm,
facility will most likely have a cane, and every facility will most likely have a water basin. So what I've done in the past is actually put the basin on the ground in the corner where it would move, and we would use the cane, which is the handle of the cane. So I would have them flip the cane, and the actual um, curved angle of the cane, they would use that as their putting side. And we
Oh
would
yeah.
also use the tennis ball. So I would either have them, either trying to go straight ahead or maybe an angle, and we just practice putting. And to make sure it doesn't go all over the room or get into somebody else's treatment area,
Yeah.
I would, I can either put like maybe something down to block it, like a bar, how we use the dowels, maybe put a dowel down to kind of keep it within a certain area and kind of play it off like that. And I've done
Mm.
that with a
Mhm.
client before that completely loved golf. And I was
Yeah.
trying to create, a situation where we could work on his dynamic standing balance.
Hmm.
And that was a really good activity for him because I was also able to watch how well his balance was, as well as his activity tolerance, stand tolerance, while he was engaged in this activity, which was fun for him.
Mm-hmm.
You know,
Yeah. I mean, and those are the things, and that sounds like a fun one. I've never tried that, but that's, I mean, you're exactly right. Those are all things you actually already have in your clinic in general, right?
right? So
And
it's just
and
those basic things that we will generally have. I mean, we're not all facilities are not going to have the same thing, but the basic things you can actually really do a lot with if you kind of just think outside of the box.
mhm. Yeah, I mean, and even things like that, you can work on so many different, I mean, you can work on dynamic balance, you can grade it, you can have them like stand on a aero pad, you can have them, you know what I mean? Like do stagger stance, you can do all sorts of different things. You could work on like if they're having a hard time like looking to, let's say they have some some neglect to the left, if you know what I mean? Like you
Right,
can take those things like you are just saying, the things that you already have, finding what's meaningful to them, and then like how do we make it work for them where, okay, this is fun. This is way more fun than just, I don't
right,
know, maybe,
right,
having them just reach,
right.
having them stand and do dynamic balance reaching is, I mean, it's not meaningful.
Mhm.
I mean, it may get the job done, but like you were saying earlier, like it just takes the time away as well. And they're working on something and it's
Right,
fun and it's fun for you. Like,
right, right. And
yeah.
even if you, let's say, 'cause, every skilled nursing facility has cones. You're going to
Hmm.
find cones everywhere you go. That's just like a
Right.
like a basic
Standard.
standard thing. And even though doing cones all the time, that's definitely not considered functional. However, it does have its moments where it's beneficial, and it also comes down to your approach and how you're using it. You know,
Hmm.
um,
Yeah.
like you said, if you're working on that midline, that neglect, and you're working on that midline crossing, that could be something to use as well as identifying the color. You know what I mean, or looking for
Hmm.
scanning. So it has its use, but it all comes down to what you're explaining to the patient before you do it, and also using that as preparatory in order to say, okay, let's go into the kitchen now, and now I'm going to have you take this item off of the counter, and you're going to reach across and put it into the cabinet.
Mhm.
You know what I mean?
Yeah.
So
Mhm.
it's really your approach and not constantly doing the same thing over and over, which completely takes away from the meaning of what the activity is supposed to entail.
Well, and just kind of like you were talking about how, being client-centered, something like that may be terrible for some clients, but maybe for
Right,
another client, they see the purpose of it and they're like, "Okay, I can get on board." You
right,
know?
absolutely. Mhm.
And just like you're also saying, like, about, really it's your approach, it's using your therapeutic use of self and, like, figuring out what works for the client and what doesn't,
And
you
I think
know?
it's important too. You have to explain. One of the things we
I
forget to do
isn't that
is
the
you
truth?
need to
Yep.
explain. Okay, this is why we're doing this.
Mhm.
You know what I mean? And I hate to use the word play when I'm doing an activity because sometimes they may not understand. Okay, this is actually working on this particular function. You
Mhm.
know, um, but yeah, you definitely will know and pick and choose who to do certain things with and who to not do certain things with.
Mhm. Yeah. I mean, some other things that I've even done is like, made some just really basic occupation-based kits to have in your facility. Because I've worked in big facilities, I've worked in tiny facilities, and, just even things that you can collect and have there for, that you can pull out. That doesn't take a lot of space and room. Like,
Mhm.
just getting together maybe a medication management basic kit. Okay, you're going to use some beads, you're going to use some bottles that you can literally get from the pharmacy,
Right.
or even like your coworkers say, hey, anybody bring in some old bottles. Like, it doesn't have to
Right.
cost a lot. It doesn't have to, but it makes it more like occupation based and meaningful. And, then you can kind of get creative and you can do color sorting. I mean, you can use that same thing for a lot of, you can use it strictly for like medication management,
Right.
or you can use it for, I mean, I don't know, visual scanning or crossing myth. I mean, you could use it for lots of things, but just maybe sometimes if you're like, especially if you're a full-time employee at these facilities,
Mhm.
just kind of planning and kind of getting some of those things together, and then it just makes it a little bit easier. But it's all about like, I mean, fun having a little collection of, is there some games that we can have for if you are going to work on standing balance, or, like how can we make it fun, you know?
Yeah, I agree with you. I definitely agree with
Yeah.
you. Just simply using like old cereal boxes,
Yeah.
using the things that you have in your cabinet instead of tossing it in the trash, you can bring it in. And if you're working on more of a high level complex task where somebody, elder is planned to go back home and they still do their own grocery shopping, that can give it more of a realistic feel, placing it lower or
Mhm.
placing it higher for them to reach. You know what I mean?
Yeah, yeah.
So,
Well, yeah. No, exactly. Well, how about little things like making treatments more like, you work in a skilled nursing facility, you're working with all sorts of clients, people that have dementia, they're in just for short-term rehab stays, they're long-term residents. How do you make treatments functional, or like if you're working with someone, let's say, that has like low level dementia, or someone that is kind of like a lower cognitive level.
mhm. Well, what I actually seem to find, well, definitely you want to stick with the basics, and you don't want to do anything that requires a frequent change.
Yeah.
Because what I found with my dementia patients is they end up thriving better with regular day to day activities versus you know throwing a ball or reaching for this and pegs, because it doesn't it they can't
Not
relate to it.
not familiar.
They're not
Yeah.
it's not familiar, exactly. So what I would typically do is usually the recreational and activities director, they tend to know these patients quite well. And sometimes I would actually go when they're having events, and I would actually sit with them and um, see how they're engaging in
Mhm.
the activity. Also, I get the backstory. If Mr. So and so he really loves music, I would use that to my advantage. If he needs to do a balance activity, but he doesn't understand why he's doing this balance act, we can say, hey, let's dance, Mr. So and so. You know what
Right.
I mean?
Yeah.
And that is meaningful to him because it's familiar. Even a
Mhm.
song, playing a song that he's familiar with. You're still working on your goal of increasing his balance or his tolerance. Even putting on a shirt, something basic as that can be difficult for a dementia person with the sequencing. So, breaking it down into steps is also helpful for these clients. I know I had one dementia patient. They kept wandering. They just had the hardest time finding their room.
Mhm.
So, and I actually mentioned this in the book too. One of the activities I did was actually put a picture on their door, and the picture was either of a particular color or something they were interested, maybe a car that they really liked, or a car that they used to have, or it could even be a picture of themselves, just something that they can kind of spark a recall, something they can relate to. And
Mhm.
when we would go to, let's say, their activities, to the dining room, then we had to find their way back to their room. I would walk with them and say, "Oh, let's look for this. Do you see that?" Just to try to make
Yeah.
it functional for them to try to create some form of a functional repetition.
Yeah.
Yeah.
Yeah. Those are the fun successes. So, like some of the things that people I've heard is that people have a hard time being creative when they feel like there's so many like productivity requirements that, and I have my own thoughts on that, but do you see that as maybe a barrier as that it limits your creativity when they have so many of those external demands?
It definitely gets difficult. It definitely gets
Yeah.
difficult when you
Yeah.
have high expectations with your productivity. But that's where the staying organized and planning comes in. I know for me, what I would usually do when I come into work, the first thing I do is, look at my caseload and see how I could organize my day and how my time can be spent optimal.
Mm.
And let's say if I
Mhm.
have a high level patient, I say, okay, well, maybe I could see this person for maybe we could work on a ADL early in the morning, or I could save them for the afternoon, and then we could do more complex tasks when it's a little less busy in the gym. So
Mm.
it really comes down to planning.
Yeah.
There's not much you can do about trying to get around productivity. You have to be
Right.
productive
I know.
at the end of
Yeah.
the day, but it really comes down to planning out your sessions, and taking it bit by bit. I mean, you might walk and you have 6 goals. You don't have to do all six
Yeah.
goals in one shot in one
Right.
session. You know what I
Right.
mean? You can do maybe 1 or 2 goals and just focus on that to make sure you're creating a form of a carryover. Um, Sometimes just doing ADL, let's say, sometimes just doing a toilet transfer, just going to the toilet and back one time is not enough. Maybe you
Mm.
have to do it maybe 3 or 4 times and breaking it down step by step. um, or let's say you're doing an activity with the use of Theraband. Theraband is, I love Theraband. You can do so
Yeah.
much with Theraband. Using Theraband to go through the sequence of upper body and low body dressing. I even use Theraband. A little cool little creative tip. What I would do is I would actually cut very small, thin pieces of the Theraband, and at the end of it, I would put like tape to make sure that's a little bit more sturdy. And by
Mhm.
doing that, I put it into their shoelaces to create shoelaces to create that elastic lace effect. And now we can work on being able to put on, don and off their shoes
Yeah.
without having to worry about them tying their lace. You know what I mean?
Yeah.
So there's
Yeah.
there's things within the facilities, but you kind of just have to open up your mind on how to do it. And by preparing the shoes, now you have a session right there, just working on being able to manage your shoes.
Mhm.
So it really
Yeah.
comes down to planning.
Man, I know.
I can't say it enough. I can't say it enough. It really comes down to, even when I go into a building, I know, and I do not know the patients at all.
Yeah.
I look at, is this person a maxicist? Is this person
Yep.
supervision? You know what I mean?
Right.
So,
Right.
and then setup also plays a part too. Like, if you're finishing with Mr. Jones, and you have, let's say, Betty's coming in, and Mr. Jones is very high level, and Mrs. Betty requires a little bit more assistance. You can actually finish off with Mr. Jones, saying, "Okay, Mr. Jones, I'm going to have you finish off this activity in sitting while I prepare for Miss Betty." You know what I mean?
Mm.
So that kind of also helps with productivity.
Mhm. Getting things set up. So what are some of the, do you have any, ideas or suggestions for kind of, we always talk about, you've been talking about out of the box idea, thinking and,
Hmm.
using some of the tools that you have in there, like using the cane as a, little putt putt as an example.
Right.
Do you have any other ideas or successes of things that you think have been really helpful in your career working in skilled nursing?
Yeah. I would say, sometimes you may not have the time to actually create things at home and bring it in. So
Right, totally.
a lot of times I would actually use what I have within the facility. So I already mentioned that I love Theraband. So
Mhm,
Theraband, you can use Theraband for actually fine motor. A little example, what I would do for that is I would actually roll it up into a ball, and I would actually have them, you know, unroll it. So let's say it's rolled up and then they have to release it. And by doing that, they're working on, grasp, they're working on dexterity, they're working on control. That's one thing they can use. Also, a lot of times you're going to find pegs in the facility. You can use this to work on medication management.
mhm.
Usually, what I would do is I'd grab a piece of paper and I would write, maybe numbers 1 through 4, and I would, say, take 3 red pegs um, in AM or morning, or let's say at breakfast time, and then take 2 green pegs at dinner time. And sometimes I'll
Mhm.
even put a name to it. Instead of saying pegs, I might say maybe your Tylenol or your clot, you know what I mean? Whatever
Right.
medication
Just
they may be,
stimulating your
right?
medication,
Whatever
yeah.
medication
Right.
they have, and you got to know how to grade it, but you can use things like that to allow it to be creative. You know what I mean?
Mm, yeah.
For your patient, because at the end of the day, a lot of these skilled nursing facilities really don't have the budget nor the resources to provide you with some things that you need. So you really have to use what they have to
Mhm.
be creative. Um, I also had to uh, I had a amputee patient, senior, uh, and he had an amputee, and it was a BKA. And one of his situation was, he was just having a lot of pain with his residual limb and keeping it on the elevated leg rest, because some facilities will have a really nice amputee cushion, but not
Sure.
all facilities will have that.
Right.
So, what I did is said, okay, well, what's the problem? He's like, I feel like my residual limb keeps falling off, and it really hurts when that happens. He's like, I just need someone to keep it controlled. So I said, okay. I went to the back, saw what they had. They had some Velcro. They had like this like strip. It's not necessarily sheepskin, but they had like a soft like material. It
Mhm.
was just similar to like sheepskin, but it's like a soft material. What I did is I connected the Velcro to it, so now he was able to take it off and put it on, and it made a world of difference for him. So it's just small little things can make a big difference um, for your patient while you're also being creative in your treatment as well.
Mhm.
You know what I mean?
Yeah. Yeah, and, like, just like you were saying about you have to use what they have, right?
Right.
And it's like, I can think of one facility where they had, like, a little, little flower garden in the front, so I'm like, "Okay, let's use that because we didn't have any supplies to do anything inside gardening and that kind of thing, so we'd actually just use the grounds of the facility. Or maybe you've been doing your putt-putt inside and now they're ready for higher level balance, or, maneuvering over uneven surfaces or whatever it is. Why, can you get on the grass? Can you get outside the building
Right.
on a nice sunny day and get some fresh air and actually
Right.
work on some higher level challenges
Right.
there?
And I mean,
Um,
I've even took patients outside and we grabbed the hose and was watering the plants.
yeah.
You know what I
Yeah.
mean? And even the
Mhm.
guys was into that because that kind of bring them back to landscaping and taking care of their yard. You know what I
Yeah.
mean?
Yeah,
And
I mean, car transfer. I mean, like, it's just like you said, it's like thinking outside the box and figuring
yeah,
out and listening to the client and seeing what do they need, and,
yeah,
like, what's important to them, what are the daily routines. If I was in a nursing home, I would, my coffee routine is a huge priority. Maybe that's something, and how can you integrate that into a goal? Like, okay, maybe working on fine motor, but how can they open the pack? You're deconstructing, doing your activity analysis, like your sandwich example. Like,
Right.
it's just like
Right.
really looking at how can you use the activities that are meaningful to them.
Yeah.
And, like, I mean, seriously, would you rather be doing like a coffee intervention where
Right.
you're actually working towards the goal, or do you want to be doing a pegboard? Like,
Right. Right.
come on,
And
you know what I mean?
and going back to productivity and time, I've had instances where, and it also depends on the facility, the liability of the facility. But I've had instances where
Yeah.
me and PT, PT is like, oh, I need to take a patient outside. I need to walk a patient outside, and I say, you know what? Can I jump in and have the patient go? Because where I was at, there was a diner across the street, and this patient
Ooh.
was going back home, and this patient really had a hard time staying motivated to really come to therapy and engage. And one of the
Mm-hmm.
things that she was asking for is, I really want real coffee and a muffin. You know what I
Yeah.
mean? So, and she was like, this is what I want. And I said, you know what? How about we go get a real coffee and muffin? So
Mm-hmm.
once we got the approval, PT was able to focus on, their gait training and distance. And I was able to say, okay, let's look at safety. Let's cross the street. Let's go inside, open the door,
Yeah.
order, pay
Mm-hmm.
for the coffee, coming back. So we worked on so many things in that one session. And it only took us, to get there and come back, it was a half an hour, and I had this patient for an hour. So
Yeah.
there's ways and means to incorporate your functions. And it was really nice to see, because after that session, she was completely excited, like, okay, when are we going back and do that again? And she was
Yeah.
a cancer patient, so her endurance is very, very low.
Uh-huh.
But she, it created a motivation of a sense of, what, I can do this. I can get out and live my life again. So it was really nice to see.
And it's fun. Like, you know.
Right.
Oh,
It's fun for
yeah.
you too, because, it keeps
Yeah.
you from getting bored.
I know, it kind of mixes things up. Well,
Right.
let's talk a little bit about your book that you wrote. Gosh, but labor of love, huh?
Oh, yeah. I actually wrote it while I was on my maternity leave.
Oh my gosh. So, Tamisha wrote a book called 12 Case Studies, Treatment Intervention, and Documentation Examples for Occupational Therapists Working in Skilled Nursing Facilities. So, why did you write that? What inspired you to?
Well, first off, that was a mouthful, right?
Yeah, it sounds very official, but yeah, that's exactly what it is.
um, you know what? It's because it has to go really back to when I first started off as a therapist, uh, OT practitioner, and just trying to look for really creative ideas and what to do within this population to make it beneficial for my patients, you know.
Mhm.
And I just found myself looking all over the internet, and even though I found a couple, that it just felt like it just wasn't enough. It wasn't concise information. It was very sporadic, kind of all over the place. I was looking at Pinterest, and I would go to different sites, and I was just like, it would be so good just to have a book tailored to skilled nursing facility, because I felt like I found so much information on pediatrics, and
Oh, yeah,
it was
yeah.
tons. But I'm like, what about skilled nursing facility? What about elders? You know what I mean?
Mhm.
So I made a decision to come up with 12 cases that I often see within the facility, which is your stroke, dementia, congested heart failure, COPD, lymphedema, amputation, cancer, even UTI, E. coli, and MRSA. That's something that we forget, but this
Yeah,
often seen.
common. Yeah,
You know
yeah.
what I mean? Contractures, that we tend to do a lot of splitting. That's the other thing that's kind of forgotten about in this setting, that you have to do a lot of contracture management.
Mhm.
So I decided to really break it down, providing a brief review of just the case, person's history, and then going into more of a patient profile, and then ending off with the treatment tips and intervention, and actually documenting what I would do after a session, what a session note would look like.
Right.
You know what I mean? And I really got good feedback with the idea to do it. When I spoke to some of my peers, and they're like, that would be really cool. I would definitely read something like that, because at the end of the day, it kind of gives you a little extra oomph when you're
Mm.
working, or when you
Mm-hmm.
have that moment like, I wonder what I could do today, or maybe what kind of tips or ideas can kind of spark my motivation.
Right.
Because we do get into a rut, and we do get tired, and some of us do definitely get burnt out. So just reading
Yeah.
something that is straight to the point, and that's the other thing too, is sometimes with information on some of these abstracts, they're so long, and by the time I get through the middle of the act, I'm already tired of reading,
Yeah.
and I'm like, so what is the point? So this is why I definitely wanted to make sure that it was very straight to the topic, straight to the point, and easy to use.
Yeah. Oh, that's exciting. Well, I'll put the Tamisha's book in the show notes if you guys want to check it out a little bit. If you want to check it out a little bit more. And you said you also have kind of like a little I don't know, you call it a sale?
Yeah, I do. If they go to Payhip, it's payhip.com/b/DLWA. They can find the ebook there. At the top of it, it'll say refer a friend. And if you click on that link, you would also get 15% off, as well as your friend will get
Oh,
15% off. So it's a nice little incentive there to
little
share.
bonus. Yeah.
Right.
Well, I'll put all the links in the show notes. And so that's exciting. Congratulations on finishing the book.
Thank you. Thank you.
And is there any in closing, I guess, is there anything that you'd like to kind of note about inspiration to people about being creative in skilled nursing facilities?
Sure.
Mhm.
A little side note, I do have a YouTube channel. You can find it at Timisha Tross. And on my channel, I really give a lot of cool, creative ideas and tricks and tips that I currently use and I do within my practice as a clinician. So definitely be sure to check that out. And whenever you're trying to get creative within this type of setting, just know that you're dealing with a human being, and they're going to have interests, and it just takes the time of finding out what it is. And when you
Yeah.
find out that interest, it will make a world of difference from when you're doing your treatment sessions.
Yes. Good one. It's so true. It's like those things that you're like, that sounds so obvious, but we do need to be reminded. And
Right,
I mean, we do make a difference in the lives
right.
of our clients, and we do have to remember that
Yeah,
that's what we're here for. So,
yeah.
well, thank you, Tamisha, so much for joining me today and sharing your knowledge and passion.
Well, thank you for having me. And you guys be sure to become a member on Manny's site. I checked it out. It's a really cool looking site. She has so much resources, and it's just nice to see that somebody's out there willing to give back.
Oh, I mean, and that's I mean, we kinda have the same goals, right? Like, we're really trying to through your book or through the membership site, it's really just trying to help others be amazing clinicians and give them the treatment ideas and things that they need so they can succeed, have the resources,
Right.
um, because I really believe that we are all in this together. Like, we are
Absolutely.
all OT practitioners just trying to make a little difference in the world. So, thanks so much, Tamisha, and thanks, everyone for listening. So, until next time.
Do you feel like you're navigating the OT world without a map? Not feeling confident or competent in your day-to-day treatments and struggling to apply your knowledge clinically? Then be sure to check out the Seniors Flourish Learning Lab membership. It has all the treatment ideas, patient handouts, clinical resources, community support, and mentorship you need to succeed. Join today at seniorsflourish.com/learninglab.